Assalamu alaikum and good morning, respected chair, distinguished colleagues, and fellow researchers. Thank you for joining this session at the 5th International Virtual Conference on Social Sciences, Education, and Innovation 2026. The focus of today's talk is about our study entitled Safety and Health in the Entertainment Industries, a Bibliometric and Narrative Review. This work is a collaborative effort between myself and my colleague, Dr. Lukman Mahmud from University Utara, Malaysia. I will begin by briefly outlining the background of the study and explaining why we adopted a combined bibliometric and narrative approach. I will then present the study aim, research questions, and methodological approach. Following that, I will highlight the key bibliometric findings and insight from the narrative review. Finally, I will discuss the implications of these findings, outline the study limitations and future research directions, and conclude the presentation. The entertainment industry are widely celebrated for their creativity, cultural value, and economic contributions. However, behind this vibrant image lies a more complex reality in which safety and health risks are often under-recognized. Historically, discussion on safety in this sector focus mainly on physical injuries and performance-related hazard, particularly in activities involving intense physical movement. While these risks remain important, they represent only part of the challenges faced by creative workers today. Over time, the nature of work in the entertainment industry has changed. Creative workers increasingly face psychosocial pressures shaped by precarious employment, performance demands, public visibility, and organizational dynamics. Despite growing awareness, research in this area remains fragmented and discipline specific. Early studies were often confined to areas such as dance science, music performance health, or theater economics, with limited cross-disciplinary integration. This situation raises a fundamental question. Have we fully recognized the human realities behind artistic excellence? To address this gap, bibliometric analysis offers a useful way to trace how research in this field has evolved over time by examining trends, keyword shift, and thematic structures. Nevertheless, numbers alone cannot tell the full story. By pairing bibliometric analysis with a narrative review, we are able to interpret these patterns alongside lived experience and contextual debates reflected in qualitative scholarship. This integrated approach is particularly valuable in safety and health research, where change often occurs gradually and in response to broader industry developments, such as the COVID-19 pandemic. Against this backdrop, the aim of this study is to map and critically interpret the evolutions of safety and health research within the entertainment industries. To achieve this, we address 5 research questions focusing on how key concept has evolved, what thematic clusters emerge, which new themes are gaining prominence, how narratives evidence deepen understanding, and what these patterns means for future research, policy, and practice. Methodologically, this study adopts an integrated design combining bibliometric analysis and narratives review. Data were drawn from Scopus and Web of Science due to their rigorous indexing standards. A title-based search strategy was used, and after screening and duplicate removal, a final dataset of 44 publications was analyzed. This slide summarizes the data screening, pre-processing, and analytical procedure used in this study. First, only conference papers, review articles, and proceedings were retained to ensure relevance and academic quality. A total of 32 records were excluded because they did not meet these inclusion criteria. Duplicate records were then removed using Syntopy, resulting in a final dataset of 44 publications, with the majority drawn from Web of Science and the remainder from Scopus. For this analysis, we use Syntopy and ForceViewer. Keyword frequency analysis was conducted to identify dominant concepts, followed by thematic evolutions analysis to trace how ideas develop over time. Finally, keyword co-occurrence clustering was used to map the intellectual structure of the field. The current slide explains how the narrative review and synthesis were carried out. Publication linked to the 10 most prominent keywords were examined in detail. Selection was guided by relevant conceptual contributions and full text availability to ensure that the most informative study were included. The content analysis focused on three main aspects. First, how safety and health were conceptualized in the literature. Second, the type of risk discussed, including physical, psychological, and ergonomic risk. Third, the management strategies and institutional responses proposed to address these risks. Finally, the bibliometric result and narrative findings were integrated during synthesis and reporting. Visual outputs were used to support interpretations, and the analysis aimed to identify thematic patterns, conceptual gaps, and emerging research frontiers within safety and health research in the entertainment industries. The keyword analysis reveals a clear temporal pattern. Earlier studies were dominated by performance-related terms such as performing arts, dance, music, and music theatre. More recent years, however, show rising attention to mental health and stigma, suggesting a shift away from purely physical risk towards psychosocial and emotional dimensions of safety. The first viewer network further illustrates this evolution. Performing arts remains the conceptual anchor of this field, but newer clusters related to mental health, depression, and stigma have emerged. These clusters indicate an expanding research agenda that now integrate physical, psychological, and organizational perspective on safety and health. This slide summarizes the purpose of the narratives review. We examine publication linked to the top 10 most prominent keywords to complement the bibliometric patterns with conceptual depth and control understanding. The analysis focused on how safety and health are conceptualized, experienced, and addressed within entertainment-related work, allowing us to connect research trends with the lived realities of creative workers. This slide summarizes the key insights from the narrative review. organized according to the most prominent keywords identified in bibliometric analysis. Starting with performing arts, the literature consistently shows that engagement in music, dance, and drama contributes positively to health and well-being. Early reviews highlight the promise of these activities for youth development, while more recent studies demonstrate how performing arts foster resilience, psychosocial well-being, and social connections across the life course. Moving to mental health and depression, the findings become more concerning. Studies conducted during and after COVID-19 period report increasing level of loneliness, burnout, and psychological distress among performers and creative workers. These works highlight that mental health challenges are not peripheral, but central to safety and health in entertainment settings. The stigma literature draws attention to barriers that prevent individuals from seeking help. Research in this area emphasizes the need for community of care and shared responsibility, suggesting that mental health risks are shaped not only by individual factors, but also by cultural and organizational norms within creative fields. Research focusing on the music industry further reinforces this point. The music sector is frequently portrayed as a high-risk psychological environment where occupational stress, job insecurity, and intense performance pressure contribute to serious mental health outcomes, including suicidality. Finally, studies under health and healthcare highlight institutional and professional responses. These include evaluation tools for arts in health programs and specialized health roles that support performance, demonstrating how the performing arts can also function as platform for broader public health intervention. Taken together, these findings reveal a field that sees expanding from viewing the arts solely as performance pieces to recognizing them as complex work environment where physical, psychological, and institutional dimensions of safety intersect. This slide captures the core conceptual shift identified in our analysis. Earlier scholarship largely understood safety in the entertainment industry through the lens of physical performance risk. Research attention centered on injury prevention, biomechanical strain, and bodily endurance, particularly in dance, music, and musical theater. This focus reflects at a time when occupational hazards were visible, measurable, and technically manageable, making physical risk the dominant safety concern. However, from 2023 onwards, we observe a clear shift in emphasis. The growing prominence of mental health and stigma indicates an expanded understanding of what risk means in creative work environments. Psychological well-being and emotional resilience are no longer treated as secondary or separatist issues. Instead, they are increasingly recognized as core components of occupational safety. The key interpretation here is that safety is no longer defined solely by the absence of physical harm. Rather, it is now understood through the human experience of work shaped by emotional demands, social expectations, and organizational conditions within the entertainment industries. This slide extends the discussions by focusing on how the field has broadened from individual performance risk to organizational and institutional responsibility. The renewed attention to the music industry is particularly telling. Recent study increasingly examine organizational culture job precarity, and post-COVID-19 working conditions. This concern highlight that risk in the entertainment industry is not only technical or physical, but also deeply shaped by how creative work is organized and governed. This study has several limitations. It relies solely on scopus and Web of Science, potentially excluding local or industry-based sources. The title-based search strategy may also underrepresent interdisciplinary research. Future studies should expand beyond physical hazard to examine psychosocial and organizational risks and develop industry-wide mental health governance frameworks that support sustainable creative work. In conclusion, safety and health research in the entertainment industry is undergoing a clear conceptual transformation. The field is moving beyond injury prevention to a broader understanding of emotional, social, and institutional risk, ensuring the future resilience of the entertainment industries require balancing artistic excellence with a comprehensive commitment to worker well-being. Thank you very much for your time and attention. I appreciate the opportunity to share this work and to contribute to scholarly dialogue on safety and health in the entertainment industry. I welcome your questions, comments, and reflections, and I wish you a very enjoyable conference. Thank you so much.